Good morning, everyone. We're going to give everyone just a few minutes to file in, and then we'll go ahead and get started. Again, we'll get started in just a minute. I'm waiting for the numbers to level off here a little bit, and then we'll go ahead and get started. All right, good morning. My name is Jamie Sullivan. I am the director for the National Center for Rural Road Safety. We're very excited to have you all joining us today for something new that we're trying out, which is a half-day virtual mini conference. And with this, we'll be hosting 3 separate sessions throughout the day. This is part 1, so we do hope to have a part 2 in the next few months. We have not picked the dates for that yet, but we will certainly announce that once we have those available. This virtual mini conference is on applying the safe system approach for rural. After each of our webinars, we send out evaluations, and we've heard loud and clear from our audience that this is a topic that you really all wanted to hear a little bit more about. So we're thrilled today to be able to put this together for you. This first session is overview on applying the safe system approach for rural. So we have just a few webinar logistics for you today. This first session, session 1, will be 1.5 hours long. There are 2 other sessions that will happen today, and you will need to register for those separately if you'd like to join them. If you are going to miss any of the sessions, all of these will be recorded and will be available on our website, both on our webinar archive page and also on the page for the virtual mini conference. We do have closed captions available for today's webinar. You can click on the Show Captions button at the bottom of your screen, and you can also use the drop-down button to adjust those captions under Caption Setting. There is an icon shown here on the screen right now that is what you're looking for. Additionally, we do have both a chat pod and a Q&A pod available for today. If you do have any questions, you can feel free to put those into the Q&A pod at any time. When we do stop for questions, I will read out those to our presenters. You can also use that Q&A pod to alert organizers if you have any technical difficulties that we should be aware of and taking care of. Again, we would ask that you use the Q&A pod only for questions. We will be using the chat pod for a few other things, so it just makes it easier for us to find those questions if you put them in the Q&A pod. We also do have a handout available for download for today. That will be dropped in the chat pod several times. That way, if you joined us a little bit later, we will make sure to drop that again so that you'll have access to it. At the end of today's webinar, we will have a feedback form that we would love for you to fill out. Again, we are trying this new virtual mini conference. We'd really love to know what you thought about it, how it worked out for you, and if you'd like to see us do these in the future. So your feedback is important here. And also what kind of topics you would like us to do in this format. We will have certificates of completion available for this and the other 2 sessions. They come out about 4 to 6 weeks after we finalize the sessions. And when you receive your certificate of completion from the National Center for Rural Road Safety, you will also have a link where you can apply for free CEUs through Montana State University. So again, that link for the CEUs will come out with your certificate of completion. Today, I'm really excited. We have 3 presenters for this first session to help talk about what the safe system approach is, both from a traditional perspective and then also from the public health pyramid perspective, what traffic safety culture is and how to apply traffic safety culture and the positive cultural framework into safe system approach for rural, and how to gauge your agencies and communities' readiness for implementing the safe system approach at the organizational level. Our very first speaker today, I'm excited to have David Ederer here, who helped author the Public Health Pyramid Perspective. David is an engineer in the United States Public Health Service. His research focuses on applying public health and system safety principles in transportation practice to create safer roads. I do want to mention when you do download these handouts, you'll have this information in case you need to contact them after the fact. I do want to note that the email listed here for David will no longer work after the next couple days. So if you do have questions for him and want to contact him in the future, please reach out to us at the National Center for Rural Road Safety through any of our email addresses, info@ruralsafetycenter.org, my own, which is jamie@ruralsafetycenter.org, and we'll get those questions over to David for you. So again, I am very excited to turn this over now to David.
Thanks, Jamie, and good morning, everyone. It's so nice to be here with you. I was really excited to be invited to speak with you all here today because I think um, a lot of cool, creative engineering and safety work happens in rural communities, and you don't often hear about it. Um, so I'm excited to chat with all of you today, speak with all of you, learn from you, and listen to some of your questions because I think it's a lot more of a challenge to try to figure out how to handle, a super straight, flat rural roadway than it is to, you know, kind of apply, you know, design guidance that really works in really dense cities. I think you all do important, challenging work. So it's exciting to get to talk about this with you. Um, so first, I want to put up a picture of a map. I don't know if anyone is familiar with this particular map. If you've read the book The Ghost Map, you're probably familiar. If maybe you went to a school of public health, you've seen this map, and the first thing that jumps out at you, you see a lot of red dots. And this is a picture of cholera cases in London in the Victorian era. And the larger the red dot, the more cholera cases there were. So you probably immediately focus on those red dots and you think, this is the problem I need to solve. You may think, oh, I need to clear some standing water or filter that water where those red dots are. But this gentleman, he was a reverend in this particular community. He said, well, actually, don't focus on um, those areas where everyone's getting cholera. You're missing the point. Uh, he knew his parishioners, he knew his community, and he said, well, actually, the people that are getting sick are all using the same water and they're accessing the same taps. And that information was shared with a guy named Dr. John Snow, who is widely considered one of the founders of what we call epidemiology. And then Dr. Snow worked with London's team of civil engineers to create one of the, I would say, great engineering achievements of all time, and that is the water system in London, where they redesigned how water was acquired from the Thames and delivered to residents of London. And that actually is how the cholera outbreaks in London were solved by understanding the problem, right? Cholera cases. And that's where the public health came in, uh, talking with the local community. That's, where Reverend Whitehead played his role, and then working with engineers and planners to solve the problem. And I think that's really analogous to what we do in civil engineering broadly and transportation engineering specifically. And this work actually led to a lot of really important discoveries that you may or may not be familiar with, including germ theory. So now we all know about these little tiny undetectable microbes that cause disease, right? And we know that we can prevent disease by washing our hands or cleaning our water systems or, you know, uh, uh, so pasteurizing, using pasteurization or other things that interfere with microbes and microorganisms to prevent us from contracting a disease. And that came out of this work. But at the time, no one knew about germ theory. They believed in something called miasma theory. And so that was if there were bad smells, bad noxious mists, um, we had to treat them. And why do I bring this up? Because miasma theory led to a lot of progress, even though it wasn't quite right. Right? That's what led to the sanitation movement. It led to a lot of really important work in public health without that more full understanding that we get from germ theory. But with germ theory, we were able to prevent even more disease and think more deeply about the disease process. Why do I bring that up? I think the traditional approaches to safety have given us plenty to work on and have brought a tremendous amount of progress. But I think as we move kind of more to this safe systems approach, uh, we can make even more progress. It's to say that the current approach isn't wrong, but I think we can do a little bit better. And so that's point number one. Public health actually isn't just counting the instance of disease. It's actually a way of describing and solving problems. And it's part and parcel to the work we all do. And way back when, we actually thought about how engineers, and I would extend this to planners, um, interact with the public health system, right? At the time, in an important public health journal, we talked about how public health engineering is an essential calling, the prime object of which is to control the factors of the physical environment, especially as they affect the health and welfare of aggregates of people. What do we do in transportation safety? We affect the health and welfare of aggregates of people. We ensure that they're safe on our roadways. We make sure they can get to work or school or the hospital. And we do that for thousands and thousands of people at any given time. So I'd argue that whether or not you realize it yet, you're all really important public health professionals. And some of you might have some training in engineering, and you probably took a course or a set of courses similar to this one displayed here, which was the training for a public health engineer. It's not all that different from uh, uh, a typical civil engineering curriculum. And last but not least, what's the big point? It's not so important that a public health engineer or planner or a behavioral safety specialist know how to build a sewer or road, is that they know why sewers or roads or whatever infrastructure is necessary and what results may be anticipated. This is talking about water infrastructure from the discharge of their contents without treatment into a body of water. So what's the point? It's not just about knowing how to build roads or create a safety program. It's about what happens when we do so. Um, Cause and effect is really important in public health, and I'd argue that cause and effect is really important to transportation practice. And so I always try to focus on cause and effect. And that was one of the limitations of the traditional ease framework, is that um, it doesn't really address cause and effect. So if you work in transportation safety, you've heard of the E's, probably. The original three were education, enforcement, and engineering, first proposed in the late 1920s. Uh, and over time, we just started adding E's. And you can argue that different ones are more important, but I'd argue one of the more important ones we need to think about is epidemiology. So around the time that we started talking about the E's, epidemiologists began to think about the causes of injury, and they started to apply epidemiologic ideas and methods uh, to a fairly novel problem. So a guy named William Haddon, you may or may not be familiar with, he was a medical epidemiologist and an engineer, became the first administrator of what we now call NHTSA, the National Highway Traffic Safety Administration. And he knew of this thing called the epidemiologic triad. And when three things come into contact with one another, namely human beings, energy, all interacting within the environment, injuries can be caused. It's just like if you're thinking about COVID-19 or any other virus, humans have to come into contact with that virus and it can be influenced by their environment. So if you're in a poorly ventilated space, uh, you're probably more likely to get COVID-19 or another respiratory illness, right? If you're in an area where there are lots and lots of people with a virus and it's really easy to transmit it via air, you're more likely to get it. So the key here is to think about energy as a pathogen. And when we think about energy as a pathogen, just like we think about a virus as a pathogen, we can start to design interventions to prevent that pathogen from coming into contact with a human being. So think about a 3-point seatbelt. That's designed to mitigate the transfer of kinetic energy to a human being's body, right? So I'm old enough to remember when we had the lap belts, right? So when you're sitting in your car and you only have a seatbelt over your lap, all of a sudden you're moving forward at the speed of the car when you stop. Then we put the 3-point seatbelt on, it goes across your chest onto one of the strongest parts of your body, your sternum. You have a really strong bone structure there and in your hips. And all of a sudden, it stops you and it dissipates that energy across a larger surface area where your body can handle it. It's much better for that energy to be dissipated across the belt, across your sternum and your hips, than for you to come into contact at a specific point on your head on the dashboard, right? When we're thinking about that pathogen, we can also change how human beings interact with their environment. We change speed limits. We tell people, hey, you're going to be driving near a school, kids are unpredictable, you should slow down, right? We can also intervene with vehicle design. Motor vehicles have changed tremendously in the past 50 years, right? We have roll cages and crumple zones. What do? They absorb and mitigate force on behalf of a human being. So when you get into a crash, I love seeing that car get crumpled up and have somebody walk away. And people will talk about, oh no, cars are getting totaled. That's good because it means that that force isn't being transferred to a person. It would be a much more serious injury if, that car didn't crumple up like an accordion, uh, and that force was transferred directly to a human being's body, right? So understanding that cause of injury is really important to us as transportation professionals when we're thinking about how to intervene and prevent injuries from happening in the first place. So uh, I was working at CDC prior to graduate school, and there's a guy named Dr. Thomas Frieden, and he proposed something called Health Impact Pyramid to explain how people make decisions about public health. It's based on that core public health principle of preventing disease when possible and acting at the population health level. So we're looking to influence population health, the health of lots of people all at once, rather than having, a doctor uh, solve all the problems. It's a lot more efficient to do things at scale than it is to meet with every human being, right? So we also know that human beings are human, right? If we want to make it easy on people to make the healthy choice, the easy choice, right? So we can tell people what to do, and that's really important, right? We tell people to wash hands, we tell people to slow down, and it's good for them to have that information, right? And in public health, we also have clinical interventions. We have amazing uh, pharmaceuticals which can help you feel better after you've um, become sick. But we also have long-lasting protective interventions. We uh, can give vaccines which provide a protective effect over the course of a lifetime. We can also change the context, right? If we make it easier to access healthy foods, it's a lot easier to eat healthily, right? We don't put the cookie jar on the lowest possible shelf if we don't want our toddlers to eat it, right? We at least in our home, we try to hide it from the kids, but that's how we change the context. And then we also recognize that lots of other things in people's lives influence the health decisions they make, and that's also true in transportation, right? You may be exposed to more diseases if you work at a daycare, right? Just because of your job, you're exposed to more disease. And you combine that with a kind of a classical engineering framework called the hierarchy of controls. This is, if anybody has worked in occupational safety and health, they're probably familiar with this risk management strategy. And this is actually focused on kinetic energy as a pathogen, right? We try to eliminate a pathogen when possible, right? So instead of having a worker go down into a mine, maybe we can automate that, right? Maybe we can send a probe to take a look down there instead of having a person doing it, or we have some kind of robot that goes down into or see this actually, my favorite example is a construction site. You're seeing more and more construction sites where we're actually able to remote control, like digging a trench and having something else be exposed to the potential for injury is a lot better than having a human being do it. We can also substitute, right? Substitute one risk for another. I go back to my construction example. You're a lot less likely to get hurt if you are operating a backhoe than if you are digging with a shovel, right? I don't know if you've spent any time doing a lot of digging, but it's hard on your back, right? I'd rather sit uh, uh, in the backhoe and do that work, let the machine do that work. I'm still exposed to some injury, right? But a lot less than if I were doing the shoveling myself. We can also put in place engineering controls, right? I don't have great posture, right? And you can tell me to have better posture all day long, but it's a lot better to engineer my chair uh, to make it easier for me to sit upright. You can also have administrative controls, which are good. We tell people to, or we have workplace policies to tell them how to be safe, and that's really important. But we also have lots of other things that are backing that up. Last but not least, PPE. Always important to have some kind of PPE when you are working in a dangerous workplace scenario, but it should be your last line of defense, right? It should be backing up all that other stuff that you've done. So using ideas from the hierarchy of controls and the health impact pyramid, we put together something called the safe system pyramid. So first and foremost, it's based on the idea that kinetic energy is the cause of injury, and that must be the focus of our efforts. We must prevent and mitigate its transfer. That's just good public health science. Um, so a lot of road safety plans will be a list of things to do, right? And that's okay. But I'd argue they need to have kind of a fundamental understanding of what's going on, and they have to have a cohesion uh, between those efforts and interventions to have a general vision of how things should work. And that should come from cause and effect, the transfer of kinetic energy. And that's what we are attempting to do, try to help people organize their ideas around interventions. So elements of the health impact pyramid are present here, where we prioritize population health impact and decrease individual effort, right? Make the healthy choice the easy choice. So it's a lot easier to tell people to slow down when their built environment or their culture, or I'm sorry, it's very difficult to tell people to slow down when their built environment and their culture say to speed up, right? You're kind of going against the wind when uh, everyone isn't rowing in the same direction, right? So if we just tell someone to do something, but everything else is telling them to do the opposite, it becomes really difficult. Uh, and we also have to be aware of the social determinants of health. Communities are all very, very different. And even within a community, people are exposed to a different risk profile. So somebody who works at night has an entirely different exposure to risk than somebody who works during the day in an office, right? At night, there's poor lighting. There may be an increased incidence of people drinking and driving. It's just a lot more dangerous, and we have to be aware of that. Uh, we also want to prioritize engineering controls as they do in the hierarchy of controls, but I kind of took them all out of one category and categorized them by individual effort needed and their potential to expose population to protective effects. So individual interventions I split into active and passive measures, or active and latent safety measures, sorry. So active are those things like seatbelts, enormously effective. They also require somebody to do them every single time. It's a lot easier to put on your seatbelt when they're comfortable, right? So that's a latent safety measure is making it comfortable and easy to put on your seatbelt in the car. And even better, your seatbelt works a lot better when your vehicle has that crumple zone and that roll cage to absorb a lot of the energy in the first place, right? And then when we have a built environment that reinforces safety, helps it makes it easier to slow down when it's appropriate, it provides an extra layer of protection and makes all of those latent safety and active measures and educational measures much more effective when our built environment reinforces all of those things we're telling people and asking people to do. So, uh, last but not least, on the pyramid, transportation professionals are part of what a mentor of mine called the invisible public health workforce. So, as stewards of safety, uh, we do one of the most important things in public health. Injuries kill a remarkable number of people in this country, over 40,000. So, I want to emphasize how important the work all of you do is, and that you're part of the team in public health. And that means a lot to me. A couple things for you to think about. You're probably hearing about the plane and helicopter crash this week from NTSB. Look at how they're talking about that, right? They do these thorough, systematic, and risk-focused investigations where they think about a long causal chain. They don't just um, say that one thing caused the crash, right? They look at all the different things that went wrong leading up to that crash uh, and try to fix the systemic failures within the system. And I think that's what we need to do in transportation safety. A lot of you may be involved in data collection or analysis. I encourage you to think about how that data is created and what it means. Often it's a simple point in time crash investigation to determine liability, which is a little bit different than thinking about risk. As you make recommendations, I encourage you to think about that forward-looking risk analysis, not just one crash at a time. How would I prevent that one crash? No, no. How can I prevent all the crashes that are a lot like this one in the future? And then last but not least, we lost a true hero in public health this week who inspired a lot of people in my field. And in 1996, he gave a really great lecture, and I love this point. He says, "Don't miss the point that 2 centuries advances finally paid off in recent decades. Public health accumulates. It took 180 years to eradicate smallpox after a vaccine became available. It'll take another 45 years to eradicate polio. We were getting better and faster at using our tools. Injury control has already paid off in its first years and will continue to get better. A lot of these ideas are new. You know, when we talk about eliminating serious injuries and deaths, that is a long-term goal. But every time we do a little bit more, we get a little bit better every day. And that's an optimistic viewpoint, and it's one I believe in. And I think in traffic safety accumulates too. So a couple takeaways. Safe systems is a public health approach in transportation safety. It's not just for cities. It's not just for rural areas. It's an approach. It's not just uh, telling people what to do. The causal chain starts long before a crash. Investigate systems just like the NTSB. We have a lot of money to improve safety. Every safety can be a safety every transportation project can be a safety project, right? And last, we can do this. Public health accumulates, traffic safety accumulates. I look forward to your questions. I look forward to working with you. I hope we can talk more in the future and go far beyond just this session we have today. Thank you so much.
Thank you so much, David. I'm really excited again to have had David here and our next couple of speakers. Many of you know our Road Safety Champion program that we do, and we've used a lot of the foundational work that these 3 speakers have put together within our Road Safety Champion program. So it's fantastic to have them here today speaking about it. If you do have any questions for David, please put those in the Q&A pod at this time. We'd love to be able to ask him a few of those. The first question that we have for you that came in, David, is when you think about who the team is, conducting the root cause analysis, who cares about those concerns? What perspectives can they share? To enrich the contextual understanding of the concern, what resources and opportunities can they bring to the process? Is there anything else that you would add to that when the team is looking at these root causes?
Sure. Excuse me. Sorry, a little stuffy here. Um, often the let's see. Well, in a crash investigation, it's often a law enforcement officer, um, and they have a specific mandate to try to figure out who is at fault for a crash uh, by law, right? They're going to have insurance companies knocking at their door to try to figure out who is quote unquote at fault. So they have to do that work, right? But I think there's a real opportunity to partner with them because they are safety professionals to think a little bit differently about how we can conduct crash investigations. I, I'm sure there are great examples of folks working together to do crash investigations, um, but it's something I think about a lot. I know there's a lot of fatal crash commissions where people get into a room and break down the different causes of a crash. I think that's a really great opportunity for different groups to bring their perspectives. Often that'll have law enforcement, departments of public works, departments of public health, and that's just a great way to start the conversation. Um, I know there are, last point, increased opportunities to um, conduct road safety audits. And I like to think about that as an opportunity to um, bring more people to the table to understand the entire context of a crash. So often we'll limit those road safety audit teams to just an engineer and a planner, but I think we should um, invite epidemiologists, invite law enforcement officers on those audits to see what else contributed to the crash. Hopefully, I answered that question. I rambled a bit.
That was perfect. And I completely agree about the RSAs and being able to invite other people to see other perspectives as well. I think that was a good point.
Thank you.
Um, Another question that we had come in for you is how do we move from lagging data, so crashes and injuries, to leading data? And what might that leading data look like?
This is a great question, and it's one that I think about a lot. Is how do we have that prospective, risk-based um, data analysis? One way I like to think about it is we often um, look at who was injured in a crash, what were they doing at the time of the crash? It's all very important. I try to think a little bit more broadly about what's common amongst all the crashes that we're experiencing, and not just was the driver distracted, were they speeding, but why? Were all of the crashes concentrated on four-lane roads? And could we take a lesson from that one four-lane road and apply it to all of the four-lane roads in our community? Was it near who knows what? Are all of our crashes near a transit stop? Are they at signalized intersections or stop signs? What is it about the risk generating process that is causing crashes, and how do we address them? I'm not sure what the right answer is, but that's kind of where I'm going is how do we shift from the outcome focus to the risk focus? And it's pretty difficult. Um, that is, I think, a really super question and one that I'll be thinking about a lot.
You talked a little bit about airplane crashes in your presentation, and
Mhm.
so there is a question in here. Someone said that they've heard many times the comparison between analysis of airplane crashes and vehicular crashes. And they saw someone note in the chat pod that there is no longer an outcry associated with the number of vehicular crashes we had. So how does the influence of perceived control, as there seems to be a belief that in private vehicles we have more control versus aviation crashes where we're passengers and there's a
Mhm.
perceived lack of control, how does that potentially influence the public's interest in addressing vehicular crashes?
A great point and a great question. Um, so I'll answer this with a story. Uh, there's a field of safety called system safety that's popular in aerospace engineering, and it was created by the Air Force in the post-World War II era. At the time, they chalked everything up. All of their air crashes were chalked up to pilot error, and that made their jobs a little bit easier in the safety realm. They just said, "Oh, it's bad pilot doing whatever." And then they started to create intercontinental ballistic missiles. ICBMs don't have a pilot, and they were blowing up. All of a sudden, uh, the Air Force had to think a little bit differently about who was actually in control of the error generating process. The same is true. We could talk about this for hours. Um, so it was that the Air Force came around and they started this system safety journey, and I think that's kind of what we're responding to. Now, how does that influence how the public um, perceives this? I think it started with the pilots and the aerospace safety community thinking differently about what causes crashes in the airline or aerospace industry. It wasn't just human error. And they came to an agreement within their field. And then eventually the public came on board. I think that's something we need to do in our field is understand that human error is a factor, but understanding why errors happen professionally. And when we get to that understanding of why errors happen and not just saying ending with the error, I think the public will start to change their minds.
Another question that came in for you is, do you have any suggestions on including public health aspects into the traditional traffic engineering education?
Oh yeah, that's another good question. Not to oversimplify it, but I think it is um, really important that traffic engineers understand the pathology of a crash, that human bodies are just at the end of the day are structures that have limitations. Just like you can only expose so much force to your bridge or your pavement structure, you can only expose the human body to so much force. And we can engineer um, to separate those forces. That's why we have uh, grade separated highways or access controlled highways, right? They're a lot safer because the speeds are really high, the forces are really high, but there's a lot more uniformity in that system. And then we kind of come down to the local level where maybe people are walking around, and we try to actually um, engineer to separate people in time and space because we know the pathology uh, that's at stake, right? Humans can only withstand so much energy in the same way that uh, doctors go through medical school and basic science training to understand um, viruses and other pathologies in order to treat them. I think engineers should be exposed to the basic pathology of our field that we need to keep people safe. We need to keep them separate from pathologic force.
And then the last question that we have for you right now can also be addressed by our other two speakers if they have something to add as well. This one is a little bit more futuristic. So the requester is saying that they're building a new 14,000 acre secure smart city in a rural county in Colorado. In that they intend to integrate self-driving cars and flying cars into the plan. They're wondering how these new motion technologies might change the way we look at road safety.
Yeah, I'll start, and then if somebody wants to jump in, um, I'd say it doesn't change how I look at road safety. I am an optimist when it comes to technology. I am excited about automation. What I don't want us to do is design our environments to meet the needs of automated vehicles at the expense of people, right? People, we have to have a person-centered approach to everything we do. And if we can have self-driving cars and flying cars help people to get from A to B safely, not at the expense of other other people, then it's great, right? We don't want to start designing um, our built environment specifically for those vehicles and those vehicles alone, because people are always, I think, for a very long time, they're going to look at other modalities to get around. Um, so I'll stop there.
I want to give the opportunity, Kari or Sam, did you have anything to add to that question?
I was going to add, this is Kari. I was going to add, what a great question to be thinking about. And I think it really fits well with just thinking about our culture. What are those shared beliefs we have around autonomous vehicles, around how we treat those in our environment? And I think it'll be fun to keep thinking about that as we move into talking about culture and what culture is and how does that fit with the work that we're doing in traffic safety.
Thanks, Kari. This is Sam. I would just add one other thing, sort of from a public health mindset or approach when we think about any intervention. So in this case, automated vehicles, thinking about accessibility and, fairness in that, opportunities, for interventions that can advance health from, a more equitable and fair, approach, I think is important to consider in that as well.
And so we'll use this point in time now to jump into our next presentation. That was a great segue into traffic safety culture. Thank you again, David, we'll come back at the end. We do have a few more questions for you if we have time at the end. And so now we're going to switch over to our next two speakers. Kari Finley is the director of the Center for Health and Safety Culture at Montana State University. She is the principal investigator on many projects that focus on traffic safety and growing healthy and safe cultures to reduce roadway fatalities and serious injuries. She's a contributing author to the book Traffic Safety Culture, Theory, Foundation, and Application. And I do want to point out and also apologize to Kari that in your participant workbook for today on the title slide, her email address spells her last name correctly, but underneath her photo, I spelt her last name incorrectly. So if you are looking to reach out to her again, know that that email address is correct. And I apologize, Kari, for that misspelling. Our second speaker in this part of the session will be Samantha Pinzel. She is a research scientist at the Center for Health and Safety Culture and a certified health education specialist. Samantha has a passion for work with communities and is a lead trainer for communities and organizations in the positive cultural framework. And I'm really excited again to turn this over to my colleagues at the Center for Health and Safety Culture.
Thank you, Jamie. I'm excited to be here. And I want to say thank you to all of you for really taking the time to convene with others who are also thinking about our work to address rural traffic safety. Everyone in this webinar, we are all important stakeholders and change makers. And so I'm really excited to be a part of this mini conference to think about our work in traffic safety together. We've been hearing from Dr. Ederer about what the safe system approach is from both that traditional perspective and from the public health pyramid perspective. And as we think about our work to improve traffic safety, we know that it's necessary, I think, to engage in this systems thinking, this systems approach. Crashes occur within a traffic system, and that involves lots of interacting components, the road users, vehicles, infrastructure, and that built environment. We also know that to fully embrace our vision of zero traffic fatalities and serious injuries, we need a supportive culture that values and prioritizes safety and shared responsibility. And so for this part of the presentation, we're going to focus on the role of traffic safety culture in creating safe systems to support that vision. Traffic safety culture really helps us to understand the shared beliefs that influence how people perceive and respond to those system level changes that we're making. In our time this morning, we're going to talk about what traffic safety culture is and how to apply traffic safety culture and the positive culture framework into the safe system approach for rural areas. We'll also discuss how to gauge your agencies and communities' readiness to implement the safe system approach at the organizational level. And then finally, we'll have time again at the end to dive into questions and have time for some conversation together about these concepts and their application for rural areas, for the rural areas that you're working in. So let's start this conversation with 3 questions. When we think about our work in traffic safety, the first question is, what are the negative outcomes that we're working to reduce or eliminate? What are the behaviors that lead to these negative outcomes? And what are the beliefs that support these behaviors? If we think about the negative outcomes first, we can think about consequences that we want to reduce or eliminate altogether. You might be thinking about negative outcomes and consequences like deaths and serious injuries. You might be thinking about pain and trauma or damages, costs, financial costs, costs associated with health. What are the behaviors that lead to these negative consequences or outcomes? You might be thinking about behaviors that we're focused on in traffic safety every day. Things like speeding, not wearing a seatbelt, or distracted driving. You might also be thinking about behaviors beyond the road users. What about stakeholders? What are some of the behaviors of stakeholders? You might think about things like vehicle design or engineers making decisions about road design. You can think about a wide range of behaviors beyond just the road users that impact those negative outcomes. Behaviors are things that we can observe. And then finally, what are the beliefs that support these behaviors? Examples of beliefs are things like, it won't happen to me, or I'm an above average driver, or I won't get caught. When we think about these 3 big questions in our work, we can start to see those connections. We can clearly identify the negative outcomes or the negative consequences that we want to reduce or eliminate. We can think about the risky behaviors that are leading to those negative consequences and to the beliefs that are supporting these various behaviors. So when we think about changing those negative consequences, and the outcomes in traffic safety, we know that we're going to have to change risky behaviors. We're going to have to move the needle on behaviors like distracted driving or driving impaired or not wearing a seatbelt. And many of the strategies in traffic safety focus on changing behaviors of road users, absolutely, but also behaviors of stakeholders and not just road users. And we know from research that to change behavior, we need to focus on changing beliefs. if our work then to improve traffic safety, we need to focus not only on it's growing those supportive beliefs, to shift those behaviors, to ultimately change the negative outcomes. In other words, if we're going to change behavior, then we are going to need to focus on changing beliefs. All of the behaviors we're thinking about, speeding and not wearing a seatbelt, those are all supported by various beliefs that we have. Now, there are beliefs that support engaging in the protective behaviors, right? Like wearing a seatbelt, or not texting and driving, or not driving after drinking. Beliefs that are protective and influence our behaviors in a positive way. We also know that there are beliefs that support engaging in the risky behaviors that we want to reduce, like not wearing a seatbelt, or speeding, or texting and driving. Beliefs influence behavior. So our work then becomes understanding what those shared beliefs are, growing the protective beliefs that people have to shift to safer behaviors that lead to better outcomes or fewer consequences. Improving traffic safety requires us to change behaviors, and changing behaviors requires changing beliefs. Now, it is almost unanimously agreed that beliefs deeply affect our actions. Beliefs are learned, and they shape our experiences. The beliefs I have about driving and engaging in various risky behaviors are profoundly going to impact how I show up as a driver on our roadways. Improving traffic safety requires us to change behavior, and changing behaviors really requires us to focus on those beliefs that we have about that behavior. So if we talk about beliefs, and if we think that beliefs are so important to behavior change, the natural question that comes up is, where do beliefs come from? If you can reflect on that for a minute, where do beliefs come from? We might say that our beliefs are based in our culture. Culture really is the shared belief of a group of people. Now, if we think about culture as shared beliefs of a group of people that influence our behaviors, then we can think about culture in the context of traffic safety. Traffic safety culture is the shared belief of a group of people that influences the behaviors that impact traffic safety. Now, there's a lot going on in this definition, so we'll just break it down just a little bit. First of all, it's a shared belief system of a group of people. And we tend to share beliefs with lots of different groups of people that we belong to. So for example, if schools and workplaces, for example, they have a group of people, and each of those is defined by a common goal. So for example, schools have a goal of educating students, and they're going to establish certain shared beliefs to support that goal of educating students. Workplaces have the goal to successfully provide a certain product or a service, and they're going to establish and share certain beliefs to support that goal. Now, beliefs generally relate to our perceptions of what's normal or expected in our social environment. Beliefs influence our willingness and our intention to behave in certain ways. And in this definition of traffic safety culture, it's focused on the shared beliefs that influence road user behaviors, but also stakeholder actions, that those behaviors and actions influence traffic safety. We want to focus on stakeholder actions because they influence the built environment and those socioeconomic factors that increase population health impact. We want to seek to not only the traffic safety culture of road users, but that culture of stakeholder groups that can act in ways to support our traffic safety goals. Now, this type of thinking, I think, really expands the responsibility for traffic safety from relying on a single stakeholder to this idea of shared responsibility amongst all relevant stakeholders. It's interesting to think about If our work is to grow traffic safety culture, then we need to start thinking through a lens that our work is to change or influence beliefs of road users and stakeholders. And we can be really intentional about growing traffic safety culture. We can be intentional about selecting strategies that grow supportive beliefs that do influence behaviors that are protective and safer and that will ultimately change those negative outcomes or consequences in our work. So now that we know what traffic safety culture is, we can talk about how do we apply traffic safety culture to the safe system approach for rural areas. We're going to talk about two ways today. The first is to foster shared responsibility, and the second is to include interventions that account for stakeholder actions, the built environment, and those socioeconomic factors that impact health and safety. So let's first talk about shared responsibility. Shared responsibility is one of the key principles of the safe system approach. Growing protective beliefs, shifting behaviors to ultimately change those negative traffic safety outcomes is a shared responsibility. We're in this together, and it's going to take all of us. This notion of shared responsibility is embedded in our approach to traffic safety. When we think about embracing the safe system approach as a guiding paradigm to address roadway safety, shared responsibility is one of those key principles. The safe system approach is focused on all stakeholders at all different levels. So how do we foster shared responsibility in growing traffic safety culture in our rural areas? We're going to talk about three ways today. The first way that we can foster shared responsibility to grow traffic safety culture is to influence or engage across the social ecology. We know that our beliefs are influenced by the relationships we have with other people. We don't operate in isolation. We operate in these social environments all around us. We're influenced by these nested layers of relationships in our social environment. And each of these layers of the social environment has the potential to influence our beliefs and ultimately our behaviors. So when we think about fostering shared responsibility to grow traffic safety culture in our rural areas, we need to engage across the social ecology. It's not enough to change the beliefs and behaviors of individuals. We need to think about changing these social systems across the social environment so that our behaviors are reinforced. What are we doing with parents? What are we doing with schools, with workplaces, with our environment, within our communities? What strategies are we engaging in at all of these different layers? When we think across the social environment, we're taking a cultural approach. We're thinking about our work from a systems perspective, knowing that we have to pay attention to the entire social system. Where before we might be focused on the individual and getting the individual to change their behavior. And now when we're thinking about the system, we're thinking about what are we doing across the system. So for example, if we think about an issue like pedestrian safety and how we grow pedestrian safety behaviors, before we might ask a question or thinking about our work to increase pedestrian safety is about focusing on individual pedestrians and selecting strategies for pedestrians themselves. We might ask something like, how do I get a pedestrian to be safer? Now, if we embrace the social ecology and that system thinking, we move to a question like this. What opportunities exist to promote pedestrian safety at each level of the social ecology? We know that individual behaviors are influenced by people and the context across the social environment. So in other words, people in an individual's life, their family and their peers, their schools and their workplaces, and their communities more broadly can all influence individuals and their behaviors. Looking at the entire social system to address pedestrian safety, I think can really expand the focus and maximize the impact of our efforts in pedestrian safety. Pedestrian safety is a shared responsibility amongst all of us, and we can work together to support pedestrian safety efforts if we think about it across the social ecology. So here's an example. I won't go into details, but I just wanted to provide an example of actions that can be promoted at each layer of the social ecology to support pedestrian safety. You can think about this for any issue that you're working on in your community. Are you working on reducing distracted driving, increasing seatbelt use? If we take a cultural approach and we look at the practices across the social ecology, we can think about what are we doing, what actions are we promoting at each layer. This is just a recent project that we were working on with the Traffic Safety Culture Pooled Fund to grow pedestrian safety. And of course, while we would still want to think about individuals and what actions we want to promote for individual pedestrians, maybe things like, using crosswalks or encouraging drivers to use slower speeds, but we want to broaden our effort and think about the actions across that social environment. What do we want families to do to improve pedestrian safety? What do we want schools and workplaces to do? And more broadly, our communities. Growing these actions, will require us to grow shared beliefs in each of these groups that are supportive of these actions. And while that can seem a little daunting, I think once these beliefs are established, those protective behaviors are more likely to be sustained. And we know that in growing a protective culture takes time. But I think it helps us to see how behaviors can be sustained long-term when we think across that social environment. Engaging across the social environment or the social ecology is a way to foster shared responsibility to grow traffic safety culture in our rural areas. Another way that we can focus or grow shared responsibility to grow traffic safety culture is to collaborate with multiple partners. Sometimes I think we get so used to working within our organizations or the small groups that we have that we don't involve or think about other partners that we want to bring to the table on these important traffic safety issues. To continue thinking about pedestrian safety, we can think about engaging multiple partners to grow shared responsibility. We know, for example, if we just look at pedestrian safety, that pedestrian fatalities have increased. Just between 2009 and 2020, pedestrian deaths increased by 59%. From motor vehicle crashes. And all other motor vehicle crashes grew by only 9% over that same period. We know that transportation stakeholders are uniquely positioned to lead efforts to improve pedestrian safety. However, whether those stakeholders engage in strategies to improve pedestrian safety is influenced by traffic safety culture, by their shared beliefs. In this project, we really thought about collaboration and what that could look like to grow those shared beliefs amongst stakeholder groups to improve pedestrian safety. And we looked at a number of different stakeholder groups that could influence pedestrian safety. I use this as an example, but you can think about the issues that you're working on in your local communities. Who are those people that we need to collaborate with, that the multiple partners that we want to bring to the table to address the issues that we're working on? And then finally, to foster shared responsibility, we not only want to engage across the social ecology and collaborate with multiple partners, but we also want to leverage the positive culture that already exists in our communities. Efforts to grow positive traffic safety culture is inherently focused on the positive within the existing culture. And the good news is that in our rural areas, there's a lot of positive that already exists. And we want to think about how do we strengthen and grow the existing beliefs that are already present, that already support those safe behaviors in our communities. I'm going to show a video for you now. This is a project in Utah that I think really illustrates this idea of embracing the positive that exists. And I'm going to play it for you, and know that you might have a little bit of buffering because I know there's a lot of folks on for this Zoom webinar today. So there might be a little bit of buffering, but I'm hoping that you'll still be able to hear the video okay and get the message. This is, again, an example from Utah that I think fosters and grows the positive that's already there. And it promotes an idea in this one county about wearing a seatbelt. So let me play that for you now.
Kari, I know it worked earlier, but we're not hearing the sound this time, if you want to try it again.
Oh, shoot. Okay. Yeah, let me try it, right? Let me try it one more time here.
I am her daughter.
I am his brother.
I am her mom.
I'm his coworker. I'm his friend. I am her husband.
We are many things to many different people. When we wear a seatbelt, not just for us, it's for all of them. Let's be together for life. Always wear a seatbelt.
I hope you were able to hear that. If not, I also put a link to it, and I know it'll come out in the notes, so that you can just dive into this Together for Life project. There are lots of different examples on there. This was just one to think about: how are we promoting the positive that already exists in this county, specifically around wearing a seatbelt? In our rural areas, in the rural areas that we're working in, there's already a positive culture that we can seek to amplify and grow. And by leveraging the positive aspects of our existing culture, changes are naturally more acceptable and sustainable. And then finally, before I turn it over to my colleague Sam, another way that we can apply traffic safety culture in the Safe System approach for rural areas is to include interventions that account for those stakeholder actions and the built environment and the socioeconomic factors that impact health and safety. When we have a diverse group of stakeholders across the social ecology, efforts to embrace the base of this pyramid may be more likely because we're going to have that broad engagement. And now I want to turn it over to Sam, and she's going to source her own slides to talk about how do we grow that shared responsibility and a positive traffic safety culture. Sam, I'll turn it over to you.
Thanks, Kari. Bear with me for a moment while I get my slides up here. Jamie, can you see our slides okay?
I can, they look great.
Okay, thanks. So next, I'd like to answer this question. This is an important question. How do we grow a shared responsibility and a positive traffic safety culture? And what I want to talk about next is taking a public health approach to answer this question. And we can do this by taking a public health approach using a process. In looking to improve traffic safety, we want to start with a clear understanding of your destination. Stephen Covey made this statement, begin with the end in mind, as a way to get us thinking about where do we want to end up? Where are we going? This statement allows us to reflect on our work in traffic safety. We must know where we're going so that we can better understand where we are now and take steps in the right direction toward our goals. Think about this in your work. Where do you want to be? What would the ideal future look like? It's important to begin with that end in mind. As we reflect on where we want to be, we can focus on what we want to reduce, like serious injuries and fatalities or crashes, but we can also shift our focus towards something we want to grow. In traffic safety, we may think about growing protective beliefs and behaviors across the social ecology to improve health and safety. We could think about growing skills among people who use the road that can reduce risk. Think about your work and think about what you want to grow. Thinking in this way about what we want to grow versus what we want to reduce or eliminate can really foster energy and enthusiasm toward your efforts. Here is the positive culture framework that we use at the Center for Health and Safety Culture. We have this 7-step process that we engage in to improve health and safety. I'm going to start on the right-hand side of the framework where you can see that green arrow. Again, this is your destination or that end you have in mind. You can see it's an upward pointing arrow. We use an appreciative frame, working to improve health and safety. So we're not only focused on reducing something, we're focused on growing protective beliefs and behaviors across the social ecology. And we do this by focusing on those cultural factors, the shared beliefs and attitudes that impact the behaviors. Now, looking at the left side of the framework, you can see it's a cycle. We often say we're never done improving health and safety. This is a process that we can continue to re-enter and get better at and more effective as we go. Next, you'll see 3 key skills that support effective implementation of the framework, which are leadership, communication, and integration. You may not see yourself as a leader, but you are all leaders. You are leading communities and organizations to safer and healthier behaviors. Communication is a key aspect of this work. We'd say it's one of the most important aspects of this work, as well as the integration of strategies, which is the skill of aligning multiple strategies throughout an organization and then systems to improve health and safety. Lastly, I want to draw your attention to the middle of the framework. Here, this is looking familiar to you now. This framework is not just about the process or the skills, but also the context in which it's applied. And that context is across the social ecology. When we look at the 7 steps of this process, each step has key activities that help you be more effective. While I don't have time to go through each step and key activities today, you can find more information on our website that's at the bottom of our slides here. And I want to acknowledge that there are many different processes that can be used in public health and prevention. A key takeaway here is that using a process to organize your work is what's most important. It can take away a lot of the guesswork. Having a process to organize your work helps you become more effective. I want to dive deeper into step 1 of our process, as that's where we begin. Step 1 focuses on planning and advocating. So here in step 1, we build relationships. We establish concern for our issue, and we also raise hope. So we're not trying to scare someone, but rather build concern for our issue and then hope. Hope that we can work on this, that we can move forward together. We also want to create a diverse group of stakeholders. So this could be creating a coalition or a collaborative group, but we know we can't do this work alone. We want to establish a shared purpose as well. Why are we all here? And what are we trying to accomplish? And we want to build capacity here in step 1. And not only your capacity, but the capacity of your stakeholders by finding alignment around that shared purpose. And here we'll also create an evaluation plan. Again, begin with that end in mind. We don't want to wait to evaluate when we get to step 7, but rather begin planning for that now. And for our purposes today, I want to focus in on an activity within step 1 that relates directly to readiness for implementing the safe system approach. Kari spoke to the importance of engaging with multiple partners and bringing diverse stakeholders together. These relationships will directly impact your capacity to carry out this work. I want to talk about building capacity now. To build capacity, we need both the resources necessary to carry out the safe system approach, and we need to be ready to implement the safe system approach. So resources plus readiness equals capacity. I think in our work, we may be more accustomed to knowing what resources we need, or at least identifying when we don't have adequate resources and then working to increase those. Our resources can be varied, right? From human resources, so the people that will need to do this work, fiscal resources or the funds we'll need, and then organizational resources, things like visions and missions, the policies that support our work, or maybe access to technology. But just as important as resources is readiness. How do we assess our readiness to implement the safe system approach? When you consider the readiness of your organization, I want you to be thinking about these 2 things. How ready is the organization to adopt the safe system approach? And how ready is the organization to take action to change the problem you're addressing? Now, let's say you ask yourself these questions and you feel readiness could be improved. You're not exactly where you want to be, but how do you actually know? How do you assess your readiness to implement the safe system approach? We've talked about how safety is a shared responsibility that starts within our own organizations, and we know we need to increase these shared beliefs and behaviors that show a commitment to safety over other competing goals and demands. But before we look outward into our communities, we first need to look at ourselves, and there's tools that can help us do this. Organizational road safety culture or traffic safety culture is the shared beliefs about road safety within your organization. This can look like a strategic plan that includes road safety as a priority. Maybe your operational procedures that prioritize safety. It could look like employees at all levels understanding safety as a priority, among other things. The Federal Highway Administration recently created a toolkit to help transportation organizations like yours assess how ready their road safety culture is and find areas for improvement. This toolkit is designed to help you focus your resources and actions to really strengthen your organizational road safety culture. It's important to note that there are actually 3 separate documents in this toolkit. There's an instruction manual, improvement strategies, as well as an improvement plan template. And all of those are linked at the end of our presentation in the participant resources slide. So I encourage you to check that out. There are 2 parts of organizational road safety culture that are really featured in this toolkit. So one is internal safety culture, which is how to create a work environment that in where employees understand that safety is a priority and that they all have this role to advance safety. And the second focus area is programmatic safety integration, which is how safety is really incorporated into the organization's processes and prioritized in their programming. So you can think of this as the 2 focus areas, sort of as the people and then the programs, all contributing to organizational road safety culture. The self-assessment process is detailed in the manual step by step. And each of the two focus areas self-assessment has three components. So there's questionnaires, there's improvement strategies, and then that improvement plan template. For the questionnaires, each question includes examples that are meant to provide additional insight so that you can answer confidently. And each question really is an opportunity to show the differences between where an organization wants to be and how it's currently going. The manual also outlines key times when completing the self-assessments for either internal safety culture or that programmatic safety integration may be especially valuable. Here on this slide are some examples of situations in which engaging in this self-assessment can be most beneficial. For example, maybe you're starting a strategic planning process. That's a great time to dive into this self-assessment. Maybe your organization's structure and safety goals are siloed. You aren't really communicating and connecting across departments. Or perhaps a safety incident has occurred. So there are unique times where this can be especially valuable. Okay, so now you've taken the self-assessment and you've identified some discrepancies in where you are and where you want to be. How do you increase your agency's readiness? The self-assessment toolkit also includes improvement strategies and an improvement plan template that can be used to increase your readiness. So you'll use the results of your questionnaires to identify strategies to increase your readiness. And once the improvement strategies have been identified, your organization can then develop an improvement plan to implement these strategies. The toolkit also includes a resource list, which includes other websites and tools and guidance documents that I think can be helpful to increase your readiness of adopting the safe system approach. To end with some key takeaways from our presentation today. Improving traffic safety is a complex challenge requiring new ways of thinking and acting. And we have a shared responsibility in this. We know we can't just focus on individual driver behaviors. Safer roads really starts with all of us. We can engage across the social ecology, collaborate with multiple partners, leverage the positive culture that already exists, and we can include interventions that account for other stakeholder actions, for the built environment, and those socioeconomic factors that we know greatly impact health and safety. Lastly, safety commitment starts within our organization. So looking at ourselves first, and then it grows outward into our communities. Thank you so much for attending. I'd like to open it up now. If there are any questions that you have, I'll turn it over to Jamie if there's any questions she's seen come up in the Q&A.
Perfect. Thank you so much, Sam. We do have quite a few questions, and we're going to attempt to get through as many as we can right now before we end our session promptly at 12:30. Let's start with this first question on vehicle tires. So we'll see which one of you may be best to answer this question. But someone would like to know what your thoughts are on the wide variety of vehicle tires in the market today. It says, it seems nowadays the all-season tire is more widely accepted amongst the public due to availability and cost. Would seem the general public might be lulled into a sense of complacencies with these types of tires. Some of our speakers mentioned considering why a crash occurred, not just because, for instance, a driver was speeding. So wondering about the lack of proper tire for a vehicle, if that could be considered and may come down to a failure rather than a failure in the engineering of the roadway. So they're wondering if this also fits into the beliefs system that you guys were talking about in the traffic safety culture people or session, sorry. They said, for example, 4-wheel drive does not equal 4-wheel stop. So I'm wondering if any of you have some more thoughts on the tire piece.
Yeah, this is Kari. I was thinking about your question. I think it does. I think you mentioned a couple of things in there. One, just like how are people viewing? What are their beliefs? What are the beliefs they have about using various tires? What those do for them? What it doesn't do for them? What are the beliefs people have around safety of using certain tires? I think when I think about shared beliefs, I think that's a good place to start in thinking, and then what are the strategies we want to use to, if the beliefs people have around that, maybe there are misperceptions, maybe they're, not everything that that people believe is correct. What are the strategies we want to use to start to shift some of those beliefs? So I think that's an interesting way. I hadn't thought about it from that, just thinking about a specific issue like tires, but I definitely think when we start to see what are the beliefs people have around that, and then where do we want to shift for, to ultimately lead us to safer behaviors or those fewer outcomes.
Yeah, and Kari made a great point there that beliefs can be either positive or negative. They can also be true or false, but it still is a belief that's held by that either individual or group of people. And so once you identify that belief or maybe a way a certain tire is impacting driver behavior, then you can work to address that belief. Whether it's true or not, it's a belief held by that individual, thus it will impact their behaviors.
Another question that came in for you two is on the shared responsibility part of the framework. This requester is saying that they feel the problem with that is that it doesn't take into account that the system is designed to favor cars. Non-motorized users are at a disadvantage by design, but they are asked to share equal weight of responsibility. How would you address this inequity by design, especially considering that driving is not socially or economically attainable by all?
I think you make a really good point in thinking about the built environment. I think this really speaks to the built environment and the how we have come. I mean, I think our built environment a lot of times has, we have long-standing built environment that I think has favored motorized travel. And so it's an interesting thing to start to think about how are pedestrians viewed within the current infrastructure we have. Then also, what are the beliefs that are supporting, continued prioritization of motorized traffic? And how do we start to think about when we're making new designs, when we're changing things, what are the beliefs we have that are influencing those decisions from, stakeholders, engineers, the design, vehicles, all of those pieces, I think, play a role in there. But yeah, I think it's important to recognize the system that we have and even the beliefs that we've had have favored motorized traffic for sure. I think it's an interesting thing to think about as we're designing and starting to look at, sharing the road with pedestrians, and what does that built environment look like, and how do we make those changes, and what are the beliefs associated with that?
Kari, I would just quickly add to that it speaks to the importance of engaging with people that will be most impacted by our interventions as well, and including them in that process, including their voices and their perspectives in that public health approach, I think is really important. Some of the past work I've done, we included people with visual impairments or those who were not able to drive. And it led to so much more success in getting audible pedestrian signals placed and things like that. So that's my key takeaway there is including those impacted by our interventions is really key, and bringing in that perspective of all people who use the road.
Yeah, thanks for adding that, Sam.
Unfortunately, we have come to the end of our time, so we will not be able to address any more questions, but I do want to thank our speakers one more time. This was a fantastic session with a lot of questions, a lot of great resources shared. I have dropped that participant workbook in the chat one more time. We had some questions asking for links to manuals. All of the resources had the links in there. So if you download that participant workbook, you will have those resources available to you in that participant workbook. We hope that you'll be joining us for the next 2 sessions. If not, again, these are being recorded and will be posted on the National Center for Rural Road Safety's website later on. So one last time, thank you so very much to David, Kari, and Sam for their fantastic presentations today. We really appreciate you joining us and giving us an overview of the safe system approach for rural. And we hope to build on that later today in sessions 2 and 3. So thank you.
Thanks, Jamie.